I'm Melissa Birdie. I'm the Vice President and Dean for the School of Nursing at Purdue Global. It's important to understand and know how to perform CPR, simply because there are over 350,000 people that die each year, according to the American Heart Association, as a result of cardiac arrest. We know that cardiac arrest doesn't always occur in controlled environments such as the hospital or physician offices, healthcare provider offices. So being able to act quickly through the use of CPR, it saves lives. If you don't know CPR and you witness a cardiac arrest, the first thing that you should do is call 911. Stay on the line with the operator until emergency medical personnel arrive on the scene and see if others around you know how to perform CPR. Ask for an automated external defibrillator and have that be by your side so that you can begin to listen to the voice prompts and connect the AED to the patient. There are many ways that one can learn CPR. The key message is that you don't have to be a healthcare provider to take CPR courses and to become certified. Anyone can learn CPR. There are a variety of ways that you can complete this training, whether it's at your local fire department or your hospital nearby, or you can look online at the American Heart Association or the Red Cross for training opportunities and classes. And what's even better is that more and more high schools are training young adults in their health promotion courses to understand and be able to perform CPR and even become certified. So anyone that has the ability should become CPR certified and know how to do CPR because it saves lives. CPR is an acronym that stands for cardiopulmonary resuscitation. This is a life-saving mechanism that is used when an individual suffers or experiences cardiac arrest. And there are two types of CPR that can be administered. One includes mouth-to-mouth resuscitation with the use of chest compressions, and the other is chest compressions only. The American Heart Association recommends as best practice that individuals that witness others experiencing cardiac arrest perform compression-only CPR. AEDs are simple to use. You learn how to operate AEDs during your CPR training. There are voice commands that walk the user through each and every step. How to power it on, how to apply the pads to the individual's chest, whether or not a shock is advised, if a shock is advised to stay clear so that there's safety in the scene. If a shock is not advised, that the individual should continue to perform CPR. So this device is absolutely easy to use and it's life-saving. One piece of advice that I'd like to add and offer up is that as a business owner, if you don't already have an automated external defibrillator or an AED on hand, I would recommend purchasing one. Again, we know that cardiac arrest happens outside of the hospital environment, outside of our physicians' offices, and often in the community. So having this life-saving device on hand when used with CPR, cardiopulmonary resuscitation, it helps to save lives. So if you don't have an AED, please go out and purchase one today.